In 2003, my family had to make a hard decision to escape the dangerous environment of my home country and come to Canada for refuge. As a refugee youth who experienced displacement, trauma, and racism, I became depressed and filled with anxiety as to what will happen to me and my family's future. Will we be allowed to stay? Will we be deported? This was all too much for me to handle as a growing youth. External factors such as language barriers, lack of resources, cultural ignorance, and stigma added to my mental depletion. Many years later, in the year 2016, when Canada was accepting refugees from Syria, I attended a public health conference which held a panel of clinicians and officials. When asked about the devastating mental impacts that these refugees and immigrants incurred, a panelist confidently stated, "We don't have to worry about them, they're resilient." Even at this time, I wondered if the general population, especially medical professionals, knew how grave that assumption was. There's this notion of the healthy immigrant effect, which may cause a lack of attention put into their mental health. And according to Stats Canada, 37.5% of Canadian youth belong to immigrant and refugee families. Yet only a handful of studies have addressed these mental health qualities of life of these youth and advocating for what matters to them. In my research, I seek to understand the mental health priorities that Albertan immigrant youth have for themselves. Using questions from a survey, we collected almost 100 unique questions that immigrant youth have. And by combining similar questions such as, how can I support my friend experiencing mental health crisis? Or, how can I access resources to support my friend? We came up with 25 questions that the youth would rank as to what's most important to them. And to directly have the opinions of these youth, aged 15 to 25, we conducted focus groups where they would choose their most prioritized questions in a rankable format of their top choices. So what's next? By having the opportunity to voice their opinions and thoughts, I can understand at this moment in time what we need to address to create a better quality of life for our immigrant youth. With that understanding, I will conduct a final focus group with youth, stakeholders such as immigrant community organizations, doctors, psychologists, and health policymakers to attain a final consensus on the rankings of these questions. Following this, a report of my findings will inform the province of Alberta of what priorities we need to focus on. The fact that these youth are not only advocating for their mental health, but also for their peers shows me something which the panelists at the conference missed. Resilience, to teach people like him and I about what matters most to immigrant youth mental health.